Hey everyone, Dr. Mike here. Today, let's talk about anemia, a condition that affects 1 in 4 people worldwide. If you're always feeling tired, dizzy, or short of breath, this video is for you. We'll break down what anemia is, how it shows up, and the latest ways to tackle it in 2024. From diagnosis to prevention, we've got you covered. Let's get you back to feeling energized and amazing. So what exactly is anemia? Simply put, it means your blood doesn't have enough healthy red blood cells. Red blood cells are like delivery trucks, carrying oxygen to every cell in your body. Hemoglobin, the protein inside those cells, is the engine that makes oxygen delivery possible. When you're anemic, you either don't have enough trucks or the engines aren't working right. That's why you feel tired, weak, or dizzy. Your body's running on fumes. Nobody wants to feel like that. Anemia isn't just one thing. It's actually a group of conditions that all share one thing in common. Your body doesn't have enough healthy red blood cells to carry oxygen efficiently to your tissues. This can leave you feeling tired, weak, and short of breath. But the reasons behind anemia can be surprisingly different from person to person. There are several types of anemia, each with its own unique cause and set of challenges. Understanding these differences is crucial, because the right treatment depends on knowing exactly what's going on inside your body. First up is iron deficiency anemia, the most common type worldwide. This happens when your body doesn't have enough iron, a mineral that's essential for making hemoglobin, the protein in red blood cells that carries oxygen. Without enough iron, your body simply can't produce enough healthy red blood cells, and the ones it does make can't do their job properly. Iron deficiency anemia can be caused by a variety of factors. Sometimes it's due to not getting enough iron in your diet. Think of people who don't eat much red meat, beans, or leafy greens. Other times, it's because of blood loss, which can happen with heavy periods, certain digestive conditions, or even regular blood donation. In some cases, your body just isn't able to absorb iron properly, even if you're eating enough. When your body is low on iron, it can't deliver enough oxygen to your organs and muscles. That's why people with iron deficiency anemia often feel exhausted, get winded easily, or notice their skin looks pale. Next, let's talk about vitamin B12 deficiency anemia. Vitamin B12 is another key nutrient your body needs to make healthy red blood cells. If you don't get enough B12 either from your diet or because your body can't absorb it, your red blood cells can't develop properly. B12 is crucial for making healthy red blood cells. Without it, your body produces fewer cells, and the ones it does make are often larger than normal and don't work as well. If you're low on B12, your red blood cells get too big and don't work well. This can lead to symptoms like fatigue, weakness, numbness, or tingling in your hands and feet, and even problems with memory or balance. B12 deficiency is especially common in older adults, people with digestive disorders, and those who follow a strict vegan diet, since B12 is mostly found in animal products. Sometimes the problem isn't diet, but rather your body's ability to absorb B12, which can be affected by certain medications or medical conditions. Another major culprit is anemia of chronic disease. This type of anemia is linked to long-term health conditions like kidney disease, cancer, rheumatoid arthritis, or other chronic illnesses. These conditions can interfere with your body's ability to produce red blood cells, or they can cause your body to destroy them faster than they can be made. In chronic disease anemia, the underlying illness often triggers inflammation, which disrupts the normal production of red blood cells. This type of anemia can be tricky to treat because it's tied so closely to the management of the chronic condition itself. And finally, there's sickle cell anemia, a genetic disorder that's inherited from your parents. In sickle cell anemia, the red blood cells are shaped like crescents or sickles instead of being round and flexible. These misshapen cells can get stuck in small blood vessels, blocking blood flow and causing pain, organ damage, and other serious complications. Sickle cell anemia is most common in people of African, Mediterranean, Middle Eastern, and Indian ancestry. It's a lifelong condition, but with the right care and support, many people with sickle cell anemia can manage their symptoms and lead fulfilling lives. Each type of anemia needs a different approach, so knowing which one you have is key. Your doctor will use blood tests, your medical history, and sometimes genetic testing to figure out the exact cause. Understanding the cause is the first step to effective treatment. Whether it's changing your diet, taking supplements, treating an underlying illness, or managing a genetic condition, the right plan can help you feel better and get back to living your life. Now that you know the 4 most common culprits behind anemia, let's look at how you can fight back and take control of your health. Now that we've explored the different types of anemia, you might be wondering, what's next? How do we actually tackle these conditions and get you back to feeling your best? The answer is that treatment isn't one size fits all. Instead, it's carefully tailored to the specific type of anemia you have, your overall health, and your unique needs. Let's break down how each type is managed, and what you can expect on your journey to recovery. The good news is that with the right approach, most people can see significant improvements. Your healthcare provider will work closely with you to create a treatment plan that's just for you. No cookie-cutter solutions here. This might involve a combination of lifestyle changes, medications, and sometimes even more advanced therapies depending on your situation. For iron deficiency anemia, the most common type, the main goal is to replenish your body's iron stores. This usually means taking iron supplements, which come in different forms and dosages. Your doctor will help you choose the right one and guide you on how to take it for the best absorption. But supplements aren't the only answer. Your diet plays a huge role too. Eating iron-rich foods like spinach, kale, beans, lentils, lean red meats, and poultry can make a big difference. Pairing these foods with vitamin C-rich fruits and vegetables like oranges or bell peppers can help your body absorb even more iron. It's important to remember that too much iron can be harmful, so never self-prescribe supplements. Your doctor will monitor your progress with blood tests and adjust your dose as needed, making sure you're getting just the right amount for your body. If your anemia is caused by a vitamin B12 deficiency, the approach is a bit different. Some people need B12 shots, especially if their bodies have trouble absorbing the vitamin from food. Others can take oral supplements. Either way, adding B12-rich foods like fish, eggs, dairy products, and fortified cereals to your meals is a smart move. Your doctor will help you decide which method is best for you, and regular checkups will ensure your levels stay in the healthy range. Anemia caused by chronic diseases like kidney disease, rheumatoid arthritis, or cancer can be more complex to manage. In these cases, treating the underlying illness is the top priority. Sometimes your doctor may recommend iron supplements, medications to stimulate red blood cell production, or even special injections. The key is ongoing communication with your healthcare team so they can adjust your treatment as your needs change. Sickle cell anemia, a genetic form of the disease, requires a unique approach. Here, the focus is on managing symptoms, preventing complications, and improving quality of life. This might involve medications to reduce pain and prevent crises, regular blood transfusions, and sometimes newer therapies that target the root cause of the disease. Support from a specialized care team is essential for the best outcomes. No matter the type of anemia, the right treatment can truly transform your life. Many people find that their energy returns, their mood improves, and they're able to get back to the activities they love. Recovery is a journey, and every step forward counts. Remember, you don't have to face anemia alone. Always work with your doctor to find the best plan for you, ask questions, and stay informed. With the right support and a personalized approach, you can kick anemia to the curb and reclaim your health. Alongside medical treatment, natural remedies can help support your recovery. Pair iron-rich foods with vitamin C, like spinach with lemon juice, to boost absorption. Herbs like nettle leaf, as tea, and anti-inflammatory turmeric may also support healthy blood. Deep breathing exercises can help you feel more energized, even if they don't increase red blood cells directly. These simple habits can make a real difference. Always check with your doctor before adding new remedies. Let's build the ultimate anemia-busting plate, one that not only nourishes your body but also empowers you to take control of your health. The foods you choose every day can make a real difference in how you feel, your energy levels, and your overall well-being. Start by loading up on iron-rich foods. Think vibrant spinach, hearty kale, protein-packed lentils and beans, as well as lean meats and fresh fish. These foods are the foundation of a diet that supports healthy blood and helps fight anemia. Heme iron, which comes from animal sources like meat and fish, is absorbed most efficiently by your body. But don't worry if you prefer plant-based options. Beans, lentils, and leafy greens are excellent sources of non-heme iron, and they can be just as effective when eaten thoughtfully. To get the most out of your iron-rich foods, pair them with vitamin C. Adding a squeeze of lemon juice to your greens, tossing in some fresh bell peppers with your beans, or enjoying a citrus fruit on the side can dramatically boost iron absorption. This simple step can make your meals even more powerful. But be mindful of calcium. While it's essential for strong bones, consuming too much calcium at the same time as your iron-rich meals can actually block iron absorption. Try to space out your dairy or calcium supplements from your main iron sources by a couple of hours for the best results. Don't forget about hydration. Drinking enough water throughout the day helps your blood stay healthy and supports the transport of nutrients, including iron, to where your body needs them most. Every meal is an opportunity to make choices that support your health. By being mindful of what you put on your plate, you can help prevent and manage anemia, boost your energy, and feel your best every day. Your plate truly is your power. Use it wisely. Pregnancy increases your need for iron to support your baby's growth and your own blood volume. Prenatal vitamins usually contain iron, but your doctor may recommend extra supplements if needed. Eating iron-rich foods and pairing them with vitamin C helps maximize absorption. Regular checkups and blood tests during pregnancy are essential to catch any deficiencies early. Stay proactive to keep both you and your baby healthy. 6. Let's answer some top questions about anemia. How long does recovery take? With proper treatment, you might feel better in weeks, but full recovery can take months. Don't stop supplements just because you feel better. Always follow your doctor's advice. Iron supplements can cause constipation or stomach upset. Try taking them with food or ask your doctor about alternatives. If you have more questions, drop them in the comments. 7. Prevention is always better than cure. Here are 5 hacks to stay ahead of anemia. Get regular blood tests, especially if you're at risk. Pair iron-rich foods with vitamin C for better absorption. Manage heavy periods. Talk to your doctor if needed. Prioritize sleep. It helps your body make red blood cells. Listen to your body. Don't ignore ongoing fatigue or weakness. Take action early to keep your energy up. 9. That's a wrap. Anemia is common, but you can take control. Know the symptoms, eat smart, and work with your doctor to stay healthy. Share your favorite iron-rich foods in the comments and subscribe for more health tips.